funky side, like this. See what I'm saying?
Hi everybody, and welcome to our weekly video of information for ABQ Dental Associates. I'm Dr. Dan, and I'm hoping that everybody had a great week and was productive, and you got things done around the house, because that's pretty much all we can do right now. So things are still in flux in terms of the governor keeping us shut down until May 15th. Dentistry, we don't know and don't have any firm commitments as to what is going to happen there. All right, one of the things I want to address is, a lot of patients are asking, well, am I going to get my cleaning appointments? When do I get my cleaning appointments? Especially those of you who have missed them because of this pandemic. And the direct answer currently is that we're still kind of working out a lot of those things. We don't know exactly how we're going to be able to manage when we do get back in the office. Are we going to be able to see everybody like we've always done so, or not? And right now, the prevailing attitude is that we may not be able to do it the same way. At this current pace, what I am essentially doing right now is just, if I do have to see someone, it's primarily only for emergencies, broken teeth, swelling, some swelling we were able to manage over the phone with antibiotics. So again, if you do have an issue, just call me and we can get on the phone and we can decide what's going to be best for you. All right, let's talk about some of the early guidelines, though, that I'd like to kind of just get you familiar with. Some of the main objective for all of this is that we want to keep you safe, I want to keep my staff safe, and we want to mitigate the spread of this virus. One of the things that's going to be new is we are going to create a questionnaire and have it available to you prior to your appointment via the patient portal. This is accessible via our website. If you have not jumped on there, take a look, and there is a link for the portal. That questionnaire that you will receive prior to your appointment, we will reach out and let you know whether or not we will be able to see you. In some cases, depending on your answers, we may actually postpone your appointment or ask that you be fully tested before we can actually see you. Currently, we also have questions about how many patients will be allowed in the office at any one time. These are things that are currently, as I stated very early in the video here, in flux. We don't know how we're going to handle these things. Part of the issue, of course, is the generation of aerosols, or sprays, you might say, that can carry the virus. In many instances, what some of the authorities are saying is that we need to wait possibly an hour between each patient. We don't really know exactly how we're going to implement some of these things, but there's definitely discussion, there's thought, and we'll do the best for everyone involved at this time. Some of the biggest issues that we currently have is the availability of PPE. Fortunately, we bought a 3D printer back in 2019, which we use primarily for night guards and model work and surgical guides. But we can also print masks. The mask itself, I'll show you here, is a face mask that will fit over your face, and it has a disposable filter that can be removed and discarded if need be. And so this is another way of our trying to be a little proactive and trying to make something that that may work out for the lack of current PPEs. Other things that we will need will be caps, gowns, booties. Going to look much like a surgical suite at this point, is what it's looking like. How do we manage sterilization? Well, very much the same way we've always done, with an autoclave. And with our post-operative procedures that include complete wipe down of each and every room. This includes the chair, the surfaces, the the light handles, for example. In fact, if you've noticed over the years that we actually cover all the light handles with barriers, things that really don't require much modification because we've already been doing these things. The thing that I have already ordered is a UV decontamination box. This uses UVC light waves to decontaminate surfaces, and this could even include PPE such as masks if PPEs were to get short. But again, with the masks that I'm printing, hopefully all we have to do is put those in the box for a couple minutes and they are sterile. So some thoughts on when you arrive in the office. Likely we'll try to maintain a max of 1 or 2 people within the waiting area, and if there are more, we will ask you to go to your car, wait until we call you and on your phone, and then we can proceed from there. Also, you can call us from your car if you need to let us know you have arrived, and that may be a nice solution so that we can actually make sure that there are no other people within the waiting area. At this point in time, we are treating each patient as infectious, and until we get testing that proves otherwise, we have to follow these kinds of guidelines and methods. One of the things you will notice is that sneeze guards will be in place in front of Michelle's and Janelle's desks. Those will be acrylic screens, much like you've probably seen at the banks and other institutions. Even the grocery stores have these now. So again, we're just trying to reduce the amount of aerosols and viral particles that can be transmitted back and forth to patients and or staff. When you walk in, we will ask that you use a hand sanitizer, which will be provided for you, and you will use that first, and then you'll be allowed to interact with the staff, and at that point staff will bring you into the operatory, and at that point first thing we will do is take your temperature with an infrared thermometer and just review the questionnaire that we had sent previously. Know that because of the fact that we do not want spread, if there are any red flags related to that questionnaire, we may need to reschedule your appointment and ask that you get tested. I want to really reiterate this because I don't want anybody offended if you come in and we say we can't treat you today. So please understand that we're trying to do our best to help everybody. It's a hard call, but it's one that we sometimes have to make. In the past, there was a product called an isolite that we will probably use now on every procedure that could generate aerosols in conjunction with our high volume evacuation. We have shown and demonstrated in-house that the isolite really minimizes the amount of aerosols that are produced. Once the isolite is placed in your mouth, we can then proceed with our procedures, and we will go from start to end without me leaving the operatory at this point in time. Once the procedure is done, then we break down the room, we dismiss you, and we are treating everybody as if they are infectious at this point. But with vaccinations, better testing, that will definitely change. A lot of this is things that are in the works. We don't know exactly what is coming down the pipe from regulatory agencies and some of our associations, but we'll try to assimilate as much as possible and implement those things to keep you safe. That's really the bottom line. That's what we want to do. As always, stay healthy, stay safe, get out, enjoy some fresh air, obviously with social distancing. Just came back from a bike ride, and a little windy, but it was beautiful outside, so it's nice to get out. But like anything, I'm getting a little bored, and I've got a lot of projects that I've already completed, so I'm going to have to find more. But again, hope all your families are well and staying healthy. From all of us here at ABQ Dental Associates, I wish you the best.
Hey guys, it's Kelsey with ABQ Dental Associates. just reaching out and seeing how everyone's doing. As we know, this virus going on, we're all doing our part of staying home, staying safe. But we do miss you, we miss your smiling faces, and I really do miss cleaning teeth. So just a reminder, making sure you're brushing twice a day, morning and night, and then also flossing daily. That way when your mouth is healthy, the rest of your body can stay healthy as well. We can't wait to see you again. We love you and we miss you, and I hope everyone is healthy and home, and we'll all get through this together.